to outline 4 points in terms of thinking about the future and how we might all think about this pandemic and about addressing it. The first point I want to talk about is almost the soft infrastructure of international relations. And in particular, let's focus on global solidarity. This is the foundation. It is the bedrock of any response to the pandemic. And not only solidarity, but leadership. I mentioned the 100-fold difference in mortality rate. Leadership is key from the highest levels of national leadership in government through to the community activists and leaders, through to our individual selves. We all can lead. Communities are key. Trust between government and communities is key. And global solidarity is a message that Dr. Tedros has said literally in his more than 110 press conferences since this pandemic began. So first plank, if you will, the soft infrastructure of international relations and global solidarity, national unity. Second plank is the tried and true public health foundations, public health interventions. At the heart of WHO's advice has been a very simple message, and this hasn't changed since January. It's been about testing. It's been about identifying and isolating and, of course, caring for every case, tracing and quarantining every contact. Those are bread and butter public health measures that really have not varied. And of course, on top of that, social measures like physically distancing, wearing masks, staying home when you're sick, washing your hands, avoiding poorly ventilated indoor spaces. And this is the core of the public health response. And it's been a consistent message. It will be a consistent message through even the vaccine period that hopefully is coming, and something that we'll need to keep doing. Here, WHO has actually, I think, really emphasized that message, but also very practically shipped tens of millions of diagnostic tests, personal protective equipment, medical oxygen, trained more than 5 million health workers through an online platform, and deployed more than 150 surge missions to help countries. And this is the bread and butter, the shoe leather, and as I say, it will be needed now and it will be needed in the future. So global solidarity, public health measures, and then the third area I want to talk about is the new scientific tools. And this is vaccines, of course, but not only vaccines, also drugs and therapeutics and diagnostics. I mentioned before that there's no silver bullet here. Even when there is a vaccine, the public health measures will be important. The rollout will not be instantaneous, and so on. The point I want to make also is it's not either or. We need to do it all. Foundations, solidarity, public health, and these scientific measures. So the thing to say about the scientific tools is it's really been an unprecedented effort. There's more than 200 candidate vaccines in the pipeline, more than 40 vaccines in human trials, and more than 10 in late stage human trials. And hopefully we'll have some good news from some of those late stage trials by the end of the year, early next year, but it'll take a while to roll that out and ensure the distribution of those vaccines. And we must not let haste get in the way of safety and efficacy, because that's so important to vaccine confidence and people at the demand side of vaccines. And I can assure you that WHO will only endorse a vaccine that is safe and that is effective. Now here, led by WHO, a number of partners have come together in something called the Access to COVID Tools Accelerator, which is about the equitable distribution of drugs, vaccines, diagnostics, both speeding them up and ensuring their equitable distribution and ensuring the pandemic is ended, including economic consequences, because this is a problem of lives and livelihoods. And in the vaccine track of the so-called ACT Accelerator is the COVAX facility, which has 184 economies having joined, including Canada, I'm happy to say. And that aims to deliver 2 billion doses of the vaccine by the end of 2021 in partnership with Gavi, the Vaccine Alliance, and CEPI, and CEPI. Now, in addition to safety and efficacy, it's very important that we keep our focus on the principle of equitable access. As Dr. Tedros likes to say, it's much better to have the vaccine distributed to some people in all countries rather than all people in some countries. In fact, there's modeling that shows that doing so drastically cuts the death rate. If you do that, it also, of course, will help restart international trade and travel more quickly. From the national standpoint, this is really important, this principle of equitable access, because it acts as a type of insurance policy. You know, many countries, including Canada, have done several bilateral deals, but no country can invest in the whole suite of vaccines and promising candidates. And this is a way to do that as self-interest in addition to the altruism. So I'm proud that Canada signed on to COVAX and hope to see Canada speak loudly in favor of the principle of equitable access, because this really should be allocation to those who need it, to those who benefit, not those who can pay the most and yell the loudest. The initial allocation framework, which WHO is developing, for example, prioritizes the most vulnerable people who have the highest death rates and healthcare workers. So I spent a little bit of time on the new scientific tools because I know that's of high interest to everybody. But I want to emphasize how it's part of a suite of things, along with the global solidarity and the soft infrastructure, the foundations, tried and true public health measures, new scientific tools, and then finally starting to think forward to recovery. It's a little early, unfortunately, to be thinking deeply into recovery because rates are rising. I'm quite familiar with the situation as also in Canada, the schools, et cetera. And I'm here in Switzerland, in Geneva, where rates are rising and rising through Europe. But let's still just touch on it briefly. This is longer term horizon, of course, and let's just put it into context. So into its economic context. So G20 countries have spent more than $10 trillion in stimulus spending. A recently published estimate by Larry Summers and others in the United States has estimated that the cost of the pandemic to the United States will be $16 trillion. By comparison, the funding gap in the ACT Accelerator is $34 billion. This is very high value for money and shows about the importance of investments in preparedness in the future. Unfortunately, we're always in a cycle of panic and neglect. And I just want to highlight that recovery and prevention of future pandemics while we're dealing with this one is going to be extremely important. Now, how do we really think about that? I'd like to put the idea of innovation and partnerships in your mind, because we have to accelerate back. We were off track to the Sustainable Development Goals. We're much further off track now. But innovation, doing things faster, better, cheaper, partnerships, these are ways to accelerate, but also primary health care. Primary health care is essential health services, including those essential public health functions to prevent future pandemics, but it's also community empowerment, and it's also multi-sectoral whole of government approaches. It has a very, very strong equity focus as well. And this would be a good point to say that COVID is a very, very cruel virus. It's an unmasker of inequities. It preys upon structural inequities, the cracks in our society, not only among countries, but within countries. If you look, for example, at test positivity rates in racialized versus non-racialized communities, you find higher test positivity rates in some cases. And it really does unmask the inequities among and between countries. So there's an opportunity here to build back better, as people say, in a concrete way with primary health care. Strong history of that in WHO, the Alma Ata conference, we're 40 years past that, but also in Canada with the 1974 Lalonde report on a new perspective of the health of Canadians. So this is an area where Canada, WHO can work very strongly together on primary health care, on recovery, with a focus on equity, including gender equality.